Hello and welcome back to the clinic. I am your dermatologist today. How may I help you? Okay. So you have a little bit of redness on your cheeks and neck. Okay. So let's have a look at your file. Okay, so you were referred by your GP. Okay. Alright. And did your GP give you a prick test? They did? Okay, let's have a look at the results of that. Okay, so that seemed to come back clear. Okay. Alright, so I am going to inspect your skin today and we'll find out a suitable treatment plan for you as well as a diagnosis, okay? Okay. So do you mind if I touch the red parts of your face? Alright. Let's see. So, are you aware of having any allergies? Okay. Nothing new? Okay. Okay. So, to help me diagnose you today and give you a treatment plan, I want to ask you a few questions. Is that alright? Okay. So how does this feel? A bit tender? Okay. Does it itch? Okay. Okay. And have you experienced any burning sensation, oozing, open wounds? Okay. Okay. I can see that the skin is very red right now and tender. Seems to be quite inflamed. And you said that you had some redness down your neck. Okay. Yeah, I see that. Okay. Okay. I'll make a note of that. So when did this start? Okay. Alright. And have the symptoms continued to come back? They have? Okay. So have you found that your symptoms have been continuous then? Okay. Now do you find that the symptoms get better over the weekend? No. Okay. And what about a breakaway? Have you had a breakaway recently? No. Okay. Now, have you found anything to make the symptoms better or worse? Okay. Okay. Now, does your work, or if you have a hobby, involve any contact with your skin? Say, like hairdresser, for example. Okay, okay. Do you wear makeup? Okay. And do you wear perfume? Okay. And do you have a skincare regime lately? You do? Okay. Do you remember what you use? Okay. Yeah, I know that one. Anything else? Okay. What's your line of work? Okay. Do you have any pets? Okay. And are you currently taking any medications? Okay, what about ointments? Are you applying any medicated creams to the area currently? Okay. And have you recently dyed your hair? Okay. Do you wear jewelry? Okay. And do you do any gardening? Okay. Alright. So I'm going to make a few notes from the answers you gave so I can update your medical history. So before I give you a concise diagnosis today, I would like to give you a standard melanoma and mole check over your face, arms and scalp, if that's alright. Okay, so not only will this help me look at any potential concerning moles or lesions on your skin, but it may help me with my diagnosis for you overall. Okay, so let's have a look through your scalp. You've been experiencing any symptoms in your scalp? Any itching? Flaking lately? Anything unusual? Nope. Okay. Okay. Alright. And does this feel comfortable? Okay. And have you been wearing sunscreen still? Yeah. Okay. Let's have a look. Moving some of the lengths of your hair so I can look all over. Okay, so your scalp seems nice and healthy, no different to last time. Nice and healthy. Okay. Okay, let's check your skin overall. Down your nose. Check down your neck. just going to do a quick inner ear inspection in case you have any new moles or possible lesions inside your ear, okay? Okay. Okay. You're doing okay. Great. Okay. Okay, very good. And your other ear. Okay, what about this ear? How's this ear feel? Okay. Okay. Okay, very good. And now I'm going to have a look at your arms. If you could place them out for me. Are you wearing any nail polish or anything? Okay. So you have a new mole. I'm going to make a note of that. Doesn't seem to be of any concern, but I like to keep a concise record for moles that crop up on the skin. That way we can track if they're changing in the future, and we'll know when they cropped up. Look in between fingers. I'm going to look under your nails as well. Good, good, good. Okay. I've noticed you have a little bit of the same rash on parts of your hands. Have you noticed this? Okay. And how does that feel? Okay. Okay. Check your other hand and arm. Okay. Good. Great. Good. Great. Alright. In between your fingers. You have a little bit that same rash there as well. Okay. Look down your arm. Okay. So the rashes appear to be present on both of your hands, on the tops, a little bit down your neck and on your cheeks. Okay. 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 So that is your general skin examination complete. So I'm going to update your medical history, the new moles that I've seen, as well as those rashes on your hands. Okay. Okay. So, I think today I'm going to diagnose you with contact dermatitis. You show all of the signs of having a typical case of contact dermatitis. So, contact dermatitis is when your body comes in contact with a substance. It could be perfume, lotions, makeup, detergents, metals, and as a result of that, sometimes our skin can tell us that we don't agree with the product by becoming flaky, dry, itchy, and red. But because I'm not able to quite figure out where exactly the issue is coming from, I would like to suggest that you receive a patch test today. Okay, so a patch test is completely harmless. It is nothing like the prick test that you received. So I'm going to cover these small pieces of medical cloth with different common allergens. I'm going to attach these to both of your arms, and because you do seem to come in contact with a lot of different typical allergens, I will probably have to apply a few to both of your arms. So I'm going to apply different allergens to the medical cloth, and I'm going to apply them individually to each of your arms, and I'm going to mark your skin with each of the allergens, and I would like you to leave those on your skin and come back and see me every 48 hours over the course of the next 5 days. So 48 hours from today's appointment, I would like you to check in with me, and we'll have a look at each of the patch tests and see how your skin is responding to them, and I'll make a note of that, and then I'll look at a confirmed case of your patch tests after 72 hours, and then we'll come to a conclusion on what could be causing your contact dermatitis. Okay? Okay. However, before we begin today, as I know that you are in quite a bit of discomfort, I am going to prescribe to you a topical steroid that will help the inflamed part of your skin, okay? So I'm going to apply this to your skin now, and this will help soothe your skin and calm it down, okay? And I'll leave the prescription with you. Okay. So let's first begin by applying this to the rashes on your hands. Now this will typically calm the itching and irritation down. And you can apply this once in the morning and once at night. If you find that you use your hands a lot during the day, you can keep this applied to your face at night if you wish. And you can wear gloves at night to keep the product on your hands. Okay. Let's get a little more. I'm going to apply that to your cheeks, and you should feel some instant How are you feeling? A little bit better? Okay. So this won't get rid of the contact dermatitis, unfortunately, but it will help relieve your symptoms, make you feel a little bit better, okay? The aim of the patch test is to figure out what of the typical allergens that you run into are causing you your discomfort. Okay, a little bit on that other cheek. So it is very common that each of us have an allergen or several allergens. And the patch test will help identify if you do happen to have any of the common allergens or multiples. Okay, so that is your steroid applied. And I'd suggest keeping that on your skin up until the evening, and you can apply a gentle cleanser to remove that and then reapply it in the evening or the morning, whatever your preference is. So, now going to begin with your patch test. I'm going to apply a few different cloths to your skin. If you could pull up your sleeve, we'll start with that arm. Okay, number 1. And number 2. Number 3. So, whilst these are on your skin, I would ask that you please do not bathe your body until the patch test is completely over. You can wash your hair, but I would advise to do that with maybe a washcloth in the sink for now. Okay. Because we don't want to alter or change the results. Yeah. Okay. I would also ask that you please do not exercise during this time, as excess sweat can also affect the results of the test. Okay. That goes there. Okay. So, at the end of me placing each of the patches onto your skin, I'll give you some skincare recommendations for now, till we can figure out what is possibly causing your contact dermatitis. Okay. So, your skin may begin feeling quite itchy irritated, as there are several common allergens being applied to your skin. But try your best to just ignore the irritation. Move on to your next arm now. Okay. Okay, very good. Very good. Okay. Okay, we're almost done applying the patches to your other arm. Okay. Just a couple more. Okay. Very good. Okay. Okay, so that is all of the patches applied. So, some general advice I would like to give you. When using any cleaning products in your home, I would encourage that you wear gloves, as you do have some rashes on your hands. It may be from possible cleaning products or detergents. I would also recommend that you use fragrance-free, dye-free lotions, detergents, and soaps, because the allergens may be the skincare that you are using. I would also recommend that you test any new product, whether that's perfumes, lotions, or makeup, on your skin, such as your inner elbow, in a small patch, before using it on your face. And as your skin is feeling quite tender, flaky and dry right now, I would highly suggest that you keep your skin moisturized throughout the day to help alleviate those symptoms you're experiencing. Okay, so you mentioned in your skincare routine some products that you use, and I've noticed that in some of those skincare products they do contain some very common allergens. Now, I won't come to the conclusion that that is what is causing your contact dermatitis, but it is definitely something to consider. So with that in mind, I would like to suggest to you some replacements for your skincare products that you're currently using. You can feel free to try these or simply pass on them, whatever your preference is. But these are products that are dermatologist tested and in some cases suggested. So you mentioned that you use a cleanser, a sunscreen, an exfoliant, and a moisturizer. Is that correct? Okay. So I think that the sunscreen you're using is very good, and I would suggest that you keep that one. But for your cleanser, I would suggest the replacement of this one. This is the Vanicream Gentle Facial Cleanser for Sensitive Skin. This has no common allergens provided in it. This is free of dyes, fragrance, masking fragrance, lanolin, parabens, formaldehyde, and other preservatives. This is also sulfate free, so this product will not sud when you apply it to your skin. It'll be a little bit more of a cream-based product. So, as with all new products, however, I would suggest that you do a small patch test on the inside of your arm. With a lot of different skincare items, you will find dyes, fragrance, masking fragrance, and lanolin included in them. Lanolin is a very common ingredient in some hand lotions, for example. So, masking fragrance means that when a product says that it is unscented, typically it means that the fragrance that was included in it has been masked so that you can't smell it, but that doesn't mean that it doesn't include fragrance. So you always want to try to look for products that say fragrance-free over unscented. And this is a very good option for that. This is also non-comedogenic, which means that it will not clog up your pores, and it's also oil-free and soap-free. So this is a very gentle cleanser, which I would highly recommend for you right now to remove makeup, sweat, and everyday build-up. Okay? Now, as your skin is very delicate right now, I would highly advise against an exfoliant. But if you would like to possibly exfoliate some of the parts of your skin which aren't upset right now by the contact dermatitis, I would recommend a chemical exfoliant. They tend to be a little bit more gentle as opposed to the bead-based scrubs. Now, out of the family of chemical exfoliants, the most gentle out of the acids, which are part of the chemical exfoliants, is lactic acid. Now, I would not suggest this particular one for you today because the concentration is quite high. I would recommend you start with lactic acid 2 or 5%, and you can water it down if you feel like it. But if you feel like you must exfoliate your skin, I would highly advise you use a chemical exfoliant such as lactic acid. This has a much higher molecular level as opposed to other acids, which means it will not work so harshly on your skin. You may have heard of other chemical exfoliants such as glycolic acid, which is another useful chemical exfoliant. Yeah, okay. So this is the exfoliant that I would recommend to you, just in a lower concentration. And some people wash it off afterwards or leave it on, but as your skin is quite irritated right now, I would highly suggest washing it off and diluting it prior to applying it to your skin. And again, as this is quite a potentially aggressive product to be using on your skin, please apply just a little bit on the inside of your elbow prior to usage. Okay, so as your skin feels quite dehydrated and dry right now, I would highly suggest a hyaluronic acid based serum or moisturizer. A typical one that I like to suggest is this one by Neutrogena. This is the Hydra Boost Gel Cream for extra dry skin. It's very important that you pick this one, as this one is the one that is fragrance free. So, hyaluronic acid helps keep moisture in your skin, and I would suggest putting a small layer of this particular product on your face. And for hyaluronic acid based products, they do need to be sealed in, otherwise they will not work effectively and your skin as a result may feel drier. So to get the best out of your products, I would highly suggest sealing in your hyaluronic acid based serum or moisturizer with a good moisturizer. Now, a good reliable product that will work very well with your hyaluronic acid based serum is this wonderful product by CeraVe. This is developed by Dermatologists, and this is their moisturizing cream. This moisturizes and helps restore the protective skin barrier with 3 essential ceramides. Now this is a wonderful product. As you can see, it has a lot of product in it, and the cream itself is very thick. And the reason for that is because you can apply as little or as much as you like all over your body. Lots of people love to use it for dry patches on their elbows, knees, feet, and some just like to use it as an everyday moisturizer for their skin. So this again is non-comedogenic, which means this will not clog the pores of your skin. It's also fragrance free and contains a little bit of hyaluronic acid to help retain your skin's natural moisture. Okay, so I would suggest applying this at least after your showers. So as I know that you won't be having a proper cleanse, wash or shower for the next few days, after your patch test is done, I would highly suggest keeping your skin nice and moisturized after your showers. So typically when we have a shower, especially when it's a hot one, our skin can feel quite dry afterwards, and that's because some of the moisture in our skin has been lost. So after you've finished your showers, I would suggest applying a fair amount of moisturizer all over your body and a thin layer on your skin, and this will help retain the moisture in your skin. Okay, so these are all of my suggestions for your updated skincare routine. You may feel free to give these a go or stick with whatever you're using, whatever your preference is. I would highly suggest them. Now, another possibility is that your contact dermatitis is being caused by a soap or a perfume or maybe a body wash that you're using. So if you'd like to consider a different choice of soap, I would like to suggest this Sensitive Skin soap by Dove. This is one of a few fragrance-free soaps that you can find. It's just a very nice, simple soap. It keeps you clean, but that's about it. It doesn't have any lovely scents to it, but it is a good moisturizing soap. So if you'd like to give this one a go, you are more than welcome to do so. So, how is your skin feeling after applying the ointment? A bit better? Very good. So I have that prescription in the computer for you, so you can bring that to your pharmacist, okay? Okay. So I will see you in a few days to see how your patch test is coming along. Do you have any questions for me? No? Okay. Well, thank you so much for visiting us today. Take care. Goodbye.